Good afternoon, class. This is our medical malpractice reform presentation. I'm Jacob.
I'm Sydney.
I'm Fadi.
So, what is medical malpractice? It's defined as any act or omission by a physician during the treatment of a patient that deviates from accepted norms of practice in the medical community and causes an injury to the patient. In other words, it's negligence by a doctor or any other healthcare professional to a patient in their care. This could be anything from neglecting to run a test to discharging a patient early, etc. So the four elements of malpractice, which we will examine farther into this video, are duty, breach, direct cause, and damages. And as you can see in this visual, the payouts for awards vary by state, and one of the goals of reform on a federal level is to put awards caps on them to level out these payouts. An example of where medical malpractice reform took place was within the case of Jason Walters versus Memorial Health Systems. So damage caps were enacted in Colorado with a maximum award cap of $1 million, and punitive damages cannot exceed the amount of $300,000. So in this case, Walters suffered severe neck pain and numbness in his extremities, mainly his arms and legs, and the ER doctor sent him home diagnosing neck strain. Walters then became paralyzed within the next few hours, and it turns out he was actually suffering from a herniated disc that was compressing his spinal cord and caused progressive neurologic injury. So within this case, the jury reached a verdict of $15 million. Pre-reform, Walters could have received this whole sum of money, but with the damage cap, post-reform, he could only receive a maximum amount of $1,300,000.
So why is reform happening? Reform is happening because the malpractice system is costly and inefficient. Annually, the costs range from $55.6 billion to $200 billion. It has been observed among the high-risk specialties that they pay among the highest rates due to difficulty of operation. This would include neurosurgeons and OBs, for example. Pre-reform, some high-risk specialties may be hard to find in some states due to those states allowing higher damage caps compared to other states. This would include neurology, psychiatry, and gastroenterology.
I'm going to go over some pros of reform, and some pros include award caps, which prevent patients from receiving too much money from the doctor or company for the damages, and doctors generally support this because they do not want to pay the patient overly for the cost of the injury. And another pro is that reform could reduce frequency and severity of malpractice claims and lower premiums. And this comes from several studies from the American Public Health Association, which prove that laws that limit payments in malpractice cases reduce the frequency and severity of malpractice claims and lower premiums. Another pro is that reform could drive down overall medical spending while increasing access to care. And finally, doctors do not practice defensive medicine as regularly when reform happens. This would be because the cap is there would be a cap, and when there's not a cap, the doctor may have to pay extra and therefore takes extra precaution, but defensive medicine is not always good as they do not put the patient's health first. Reform and award caps in general can be ineffective. This is suggested by opponents of reform, and the reasoning is because they encourage mediocre care from the doctor because the doctor knows the maximum amount owed if an accident happens in the operating room. Also, reform can limit the liabilities of corporations because without an award cap, doctors tend to practice defensive medicine, and the medical standard of care becomes secondary to risk management and avoiding lawsuits. Plaintiffs also may not be made whole again, and this includes punitive damages, lost earnings, and emotional distress from their injuries.
So what does medical malpractice reform mean for patients? Patients are likely going to see less in damage settlements. This is because of the caps being reduced and even across the board. So for the example earlier with the Colorado case, the jury awarded $15 million, but they only ended up getting $1 million because of that cap. I guess a benefit for patients would be that they are likely to see an increase in care access. This is because high-risk specialists won't be congested in states that are more lenient with settlements.
This connects to tort law because medical malpractice as a whole follows tort law. And going back to the first slide, we have duty, breach, direct cause, and damages. Duty is when the doctor has a duty not to injure the patient, and breach is when malpractice occurs and the doctor breached their duty. And one case we saw this in this presentation was Jason Walters versus Memorial Health Systems, as the doctor discharged the patient before truly knowing all of the symptoms. Direct cause also is when the doctor injured the patient, and damages include the patient should seek a settlement for their economic and pecuniary damages.
In conclusion, there are varying opinions on whether medical malpractice reform is beneficial or harmful to those it affects. Those who support medical malpractice reform usually tend to side with the physicians and healthcare professionals and believe that less damages imposed on the doctors is better for everyone involved, whether it be the plaintiff or the doctor or the insurance company, etc. Those who oppose medical malpractice reform believe that the patients will not be able to receive the proper monetary value to make themselves whole again. This means that the non-economic caps and economic caps imposed during the reform hinder their ability to fully be compensated for what they lost during the malpractice.